Living with chronic back pain can feel like a constant burden, especially for older adults who already have to deal with the natural changes that come with age. Many seniors describe the experience as if walking through the day is a punishment, where every step is heavy, every movement feels restricted, and the simple joys of life, like walking outside, bending down to pick up something, or even sitting comfortably, become challenging. Chronic back pain, by definition, means discomfort that lasts more than 3 months, and for many people, it doesn't just go away with rest or a short break. It lingers, it limits daily activities, and it can make someone feel isolated or even discouraged. But the truth is, while it may never fully disappear for some, there are many things older adults can do at home to reduce the pain, improve mobility, and regain a sense of independence without always having to rely on strong medications or expensive treatments. Let's talk about this in a way that is practical, simple, and easy to follow. The first thing to understand is why chronic back pain happens more often in older adults. As the body ages, the spine goes through natural wear and tear. The discs between the bones of the spine lose water, become thinner and less flexible. The joints that connect the bones may develop arthritis, and the supporting ligaments and muscles can weaken over time. Sometimes small bony growths, called bone spurs, form and press on nerves, causing pain that may travel down into the legs. Conditions like osteoporosis also make the bones weaker and more likely to develop small fractures that can cause pain. All of these changes are normal with age, but when combined with habits like sitting too long, standing in poor posture, lifting heavy objects incorrectly, or not exercising regularly, the pain can become worse and more constant. The good news is that while you cannot stop aging, you can take simple steps at home to make your back stronger, reduce pain, and protect your spine. Movement is one of the most powerful tools. Many older adults feel like resting is the best solution when pain appears, but too much rest can actually make the muscles weaker and the pain worse. Instead, gentle daily movement is essential. Something as simple as walking for 10 to 15 minutes, 2 or 3 times a day, can help keep the joints lubricated and the muscles active. If walking outside is difficult, even moving around the house regularly, avoiding sitting in one position for too long, and standing up to stretch every 30 to 60 minutes can make a big difference. Exercises that gently stretch the back, hips, and legs, like bending forward slightly while holding onto a chair for support, or gently bringing one knee toward the chest while lying on a firm bed, can relieve stiffness and improve flexibility. Another important step is to strengthen the core muscles. These are the muscles in your abdomen and lower back that support the spine. Stronger core muscles act like a natural brace that keeps the spine stable and reduces the pressure on painful areas. For example, a very simple exercise is called the bridge. You lie down on your back, bend your knees, and then gently lift your hips a few inches off the bed while tightening your stomach muscles. Hold for a few seconds, then relax. Doing this a few times every day can build strength over time without putting too much strain on the back. Always remember, start slowly, move gently, and never push into sharp pain. Heat and cold can also help manage daily discomfort. If the pain is recent or flares up suddenly, a cold pack for 15 minutes can calm inflammation. If the pain feels more like stiffness or muscle tightness, a warm compress or heating pad can relax the muscles and increase circulation. Just make sure the temperature is safe for your skin, since older adults may have more sensitive skin that burns more easily. Switching between heat and cold depending on how your back feels can be an easy and safe way to manage symptoms at home. Posture is another key factor. Many seniors unknowingly add stress to their backs simply by how they sit, stand, or sleep. When sitting, always try to keep the back straight, shoulders relaxed, and both feet flat on the floor. A chair with good back support is better than a soft couch that lets you sink in. When standing, try to balance your weight evenly on both feet instead of leaning to one side. When sleeping, use a mattress that is firm but comfortable and a pillow that keeps your head aligned with your spine. For people who sleep on their side, placing a pillow between the knees can reduce strain on the lower back. Small changes in posture and habits can prevent pain from getting worse throughout the day. Nutrition and overall health also play a role. Strong bones need enough calcium and vitamin D, which often decrease with age. Eating foods like milk, yogurt, leafy greens, or fortified cereals can help. Sunlight exposure in the morning can also boost vitamin D naturally. Keeping a healthy weight is equally important because extra weight, especially around the belly, puts more pressure on the lower spine. Staying hydrated, eating fresh fruits, vegetables, and lean proteins also support muscle and joint health, while reducing foods that cause inflammation like processed sugars and unhealthy fats may ease pain in the long run. There are also supportive tools that can make daily movements safer and less painful. Wearing shoes with cushioned soles, using a cane or walker if balance is an issue, or even wearing a soft back support belt when moving around a lot can take pressure off the spine. Gentle massage, if available, can relax the muscles, but it should always be done softly to avoid injury. If you enjoy water activities, walking in a pool or light swimming is wonderful because the water supports your body weight, reducing strain on the spine while still allowing movement and exercise. Now, while most cases of back pain can be improved with these at-home strategies, it is important to know when to see a doctor. If the pain comes on suddenly after a fall, if it is very severe and doesn't improve with rest or home care, or if you notice numbness, weakness in your legs, or problems controlling your bladder or bowels, those are signs of something more serious and need medical attention right away. Also, if your pain is accompanied by fever, unexplained weight loss, or overall fatigue, you should not ignore it. Doctors can run simple tests like X-rays or scans to check if there is a fracture, nerve problem, or another condition that needs treatment beyond home care. Living with chronic back pain may feel discouraging, but it doesn't mean life is over or that every day has to be filled with suffering. With small, steady steps like gentle movement, stretching, strengthening, proper posture, using heat and cold wisely, eating well, and using supportive tools, older adults can reclaim much of their independence and reduce daily discomfort. Remember, consistency is the key. Doing a little bit every day is more powerful than doing a lot only once in a while. And most importantly, don't lose hope. Many people who thought they would never improve have found relief by making small, simple changes to their daily routines. If you found this podcast helpful, please take a moment to like the video, share it with friends or family who might be struggling with back pain, and subscribe to the channel so you don't miss more practical health tips designed especially for older adults. Together, we can build a stronger, healthier, and more comfortable life, even with the challenges that come with aging. Your support helps us keep creating content that makes a real difference,